The PREDICT DNA trial enrolled patients with early stage triple negative or HER2 positive breast cancer that were undergoing neoadjuvant systemic treatment, which included chemotherapy or a targeted therapy before surgery. In the current standard of care for patients undergoing systemic treatment before surgery, prognosis is driven by a measure called pathologic complete response, or PCR, at the time of surgery. In other words, if no cancer is detected at surgery, patients are said to have a pathologic complete response. And this is a good prognostic sign that those patients are at a lower risk of having a future recurrence. In this trial, patient ctDNA was monitored throughout treatment, prior to, and following surgery to determine if it could be used to predict if someone has no evidence of disease or needs additional treatment. Dr. Cobain provided more insight on this trial.
One of the things that the PREDICT DNA study helped us understand was that it may be that regardless of having a pathologic complete response, the circulating tumor DNA being negative or undetectable just before surgery may in fact actually be a better predictor of long-term outcome than the presence or absence of cancer remaining in the breast or the lymph nodes at the time of surgery. So again, this is preliminary data. I think there is longer term follow-up data that needs to be collected in the context of this trial. But the preliminary evidence suggests to us that circulating tumor DNA being negative prior to the patient going to the operating room was actually highly predictive of a very, very good long-term outcome.
You can learn more about this and other highlights from ASCO 2025 in the video linked below. While this preliminary data indicates that ctDNA could be used in the clinic to predict prognosis in early-stage breast cancers, researchers still need to gather that long-term follow-up data.